This is part 3 on our knee case. On the first video we demonstrated that she presented with reduced patellar mobility on the right, and she also had a lack of spring on the distal femur, and she had reduced knee flexion on the right side. On day 1 we treated the right knee by gaining anterior glide of the femur while blocking the tibia. We performed that for 5 minutes. And she did make improvement. We did discern that she appears to have a leg length difference, with the left leg being shorter by about 1/4 of an inch. So we discussed use of heel lifts and accommodating to that. And today she returned for the second visit, and we found that this was still improved and knee flexion was still full, but she actually had reduced anterior to posterior glide at the tibia. So we ended up treating the tibia, and this is distinct in relationship to the previous 2 knee videos that we filmed in which we restored anterior glide of the femur. So it is important, after restoring anterior glide to the distal femur, it's still relevant to test the mobility of the tibia specifically. And with Heather we found today that this mobility of springing tibia posteriorly, that was restricted. And so we blocked the distal femur and placed a prop underneath the ankle and restored anterior to posterior glide of the tibia by placing a 5-pound weight on that for 5 minutes. And so at this point the passive accessory motion is much more normative on the tibia, and on the femur it is much more normative, very similar to on the other side, and the same thing with respect to patellar mobility. And so I just wanted to insert that quick point, reinforcing that it is important to test the accessory motion of the tibia. And in terminal extension, of course, the tibia does externally rotate, so it is also valuable, of course, to evaluate external rotation play of the tibia, and if absent, to restore that. So that summarizes the video of the third case that I have seen in the past 3 weeks of someone who lacked anterior glide of the distal femur. Thanks very much.